guys, so don't know if we're live. Oh, I think we are live, so here we go. Alright, so it's been a while. It's been pretty busy these last couple of weeks. Whew. That's a lot to take on, a lot going on in the world back home. I'm camping out in Australia, so it's pretty intense back home, seeing a lot of footage, so I hope everyone's safe and doing pretty well. I haven't done a live in a long. It feels like a long time. It's probably been a couple days, a little bit more, probably a little bit more than a week, and I just been busy. So clinic's really picked up. I've expanded my new space. It's a brand new healing room where I'm seeing not just one person at a time. I'm treating multiple people at a time in my new room now, so that's just working out some. It's a teething process, so I've been away for a bit, so apologies for not answering the questions. I know there are people that have a few questions, so I'm just going to jump right into it. Today I want to talk about sugar cravings, because that's a question I get very often, is there a secret weight loss point, for pressure point to lose weight? And I did a post the other day, and there isn't. I want to tell you there is one, but I hate to break it to you, but there isn't. There's good old-fashioned diet and exercise, self-discipline, and control, pretty much. So really great thing that I've been recommending to a lot of my patients is actually for sugar cravings, particularly. Even though there are no secret acupressure points for weight loss, there are some things that you can do to curb sugar cravings, which in effect help you lose weight. So a really great product that I always recommend to my patients, and I've been trying lately myself, is Gymnema. So it comes in capsule form and in droplet form. So I spoke with the Mindy from the store at Vive, and they actually have it, and I've never tried it before. I learned about it in a functional medicine group that I program that I did a couple years ago, so they kept talking about it, so I started recommending it, and the feedback's been great so far. So I myself, I'm human too, so I have sugar cravings, so I started using it as well. So I've started using this little droplet form right here. It's let me pull up this thing right here. This camera right here. So it's like, it comes in this little droplet form, and what you do is you just take it out like a little dropper, and you see here it's like a little drop. Oh, don't want to drop it on my computer, but just put it on your tongue. So 2 teardrops. It's really bitter. It's really bitter, but it works. It's very effective. So I did a couple drops, and right now, if I were to put a piece of candy in my mouth, or the other day I tried a date. Dates normally are very, very sweet, but when I put it, it literally tasted nothing. Before that, I tried a piece of chocolate. Chocolate tasted like just nothing. So it's literally called the Sugar Destroyer. So I've been using this the last week, and actually I don't know if it's a psychological effect. Maybe it is, and I'm sure. Actually, I know it's definitely not a psychological effect. Like, everything you put in your mouth after you do the Gymnema drops tastes like crap. So you don't want to taste any sugar at all. So like I said, there are definitely things. Check it out. It's called Gymnema. Comes in droplet form or capsule form if you're interested in that. So I've also got a free acupressure book. So if you haven't signed up for the email list, that's all you have to do is fill that in. And if you're watching this on YouTube, make sure to subscribe. But definitely put a lot of time into the acupressure booklet. It's a lot of stuff. It's no fluff at all. 7 most commonly used acupressure points for instant pain relief. So if you haven't downloaded that, check that out. And I wanted to answer some questions in the Facebook group. So, and I do apologize. It's been a while since I posted anything. It's been a very intense 2 weeks. So Michelle had a question. She was suffering from fibromyalgia, and right now she wrote, I have soreness, stiffness in my shoulders, stiff neck pain, which is projected to the base of the skull. Feels like a spike. It's radiating pain. Well, that sounds painful. I'm sorry, Michelle. Excuse me. Now, along sinuses, my forehead and top of the bridge of the nose. I go to the GP in the morning, but the doctor pretty much dismissed me. Okay, I'm sorry to hear that, Michelle. So I'll do what I can to help you out as much as I can. So starting off with your first question, neck pain, that feels like a spike. Ooh, that's so really quick. Let me see my pointer. I'll just use a pencil. So I can't seem to find my little tool, but I'm just gonna use a pencil. So really quick and easy way that I learned from one of my teachers, Dr. Tan, was really quick and easy. If you just draw a line right through your hand right here, these points are really great for neck pain. So right off this knuckle here, 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 and at the end over here. So if you make a closed fist, this point is here. So just press any tender spots all across this area. So you want to just press like this, and then here, and then here. So any of these spots that are sore in between your first knuckles right here. So press through there. These are really great for neck pain. Since your fibromyalgia tends to move, if you guys don't know about fibro, it's a pain that it's actually very, very ambiguous. Even the diagnosis itself for fibromyalgia is very unclear. So it's if they do a quick test, if you are sore or having pain in tenderness in 20 of these most common spots, then that is classified as fibromyalgia. So that doesn't really give you an answer. It's just a general name for chronic pain. So inflammation levels, that just pretty means the inflammation levels of your body are very, very high. And when they spike, that's when the pain starts to come. So to answer your question, Michelle, try any sore spots through here, 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 and here. That is for the neck. So for the, let me look back, just make sure I caught everything. So radiating pain, base of the skull. Base of the skull, you can also do another point here, which is over here, right at the snuff box, right where your thumb and your wrist, just a little spot right here, you can just press onto there. That's really great that can work for the throat, but also for sinuses as well. Another really great acupressure point that you can try, Michelle, is just right off the nose. These are called the wings of your nose. It's called nasal ali, and what that basically is just off the wings of your nose. Right over here, you should find 2 tender spots and just press through here. These are really great for clearing up sinuses and sinus pain as well. You have another point right here in the middle between your eyebrows. This helps for sinuses as well. It's called yin tang in Chinese medicine. They call it your third eye. So when you're meditating and you have your third eye open, that's exactly that point. That's what they say. So, but also happens to fall on top of your sinuses as well. So pressing on here helps your sinuses at the same time. So quick review here and these 2 spots over here, Michelle. For the neck, again, anyone that has neck pain, straight through there. Any points through here, that's a quick and easy way for neck pain. I hope that helps. You can do both hands as well. So I'm moving on to Julie's question. Julie Smith, struggling with the muscle spasm, upper back mainly for the past 6 days, but doesn't seem to let up. Tried a water bottle, back stretcher, even releasing the muscle. Ease and goes, but it returns. I have sciatica. Julie, if you have sciatica, there are some videos in the previous posts. I should have at least 3 videos on sciatica as well. So sciatica, easiest point right here is in between your ring finger and your pinky, and you just press through here all along here. This should help with sciatica as well. There's more. You can either check out the acupressure booklet. You can download it. There are some points on there as well. And we've got some back pain courses in the link as well, description. You can check that out. But I would try this first for sciatica. So for upper back pain, here's a really great one, Julie. Upper back pain, again, I think I did a video on this. I don't know if you've seen it, but if you have upper back pain, anywhere across here, this is called the thenar eminence. So in Chinese medicine, they call it like the fish belly because it kind of looks like the belly of a fish. If you imagine this is the tail. This is the belly of a fish. So if you press along the line right off the bone of where this fish belly is, right where your muscle and your bone of your finger meets, if you press right off here, you're going to find some tender spots all through here. These spots here, they're really great for upper back pain. You can press there. You can do either side, both hands as well. See which one is more tender. I would press both. I would press both, sorry. And one last thing for upper back pain, you can also try, Julie, upper back pain, you can try, if you just flex, we haven't worked out in a while, but if you just make a muscle here, right off the side over here, you're going to feel this biceps muscle right here. And right in this divot in between where the bicep or the 2 muscles are, if you press through here, these spots here, you can press your left hand or your right hand, You can try. That may work for upper back pain as well. I know it's been a couple of days since I answered your post, guys, so hopefully it's not too late, but hopefully the pain is over with. So that will not make all the pain go away completely, guys. The pain does come back, but you can press it again just to get the inflammation levels down to the point where you can do some exercises, roll it out. It should help with the inflammation process. Okay, guys, I hope that helps. I'm just going to check. Oh, hi, Michelle. Great. So, yeah, you're on here. So, yeah, give that a try, Michelle, and let me know how it goes. I'm really, yeah, fibromyalgia is a tricky one because technically there's no cure for it, but there are things you can do to self-manage. Best thing would be to do is continue to do exercises, find a good exercise physio that can help you manage the pain as well. Another thing is if you're married or if you have a partner, there's a great tool that I recommend to a lot of my fibromyalgia patients, which is called cupping. So I've been trying to put out an online cupping course for the past year now. Every time I do it, I redo it. It gets really. Oh, Izzy's still laughing at the sugar question. Every time I start with this cupping course, I get derailed and I get stopped, but I will put one out. But if you go online and you Google search cupping set, especially if you have upper back pain or lower back pain, Michelle, that cupping from my previous fibromyalgia patients, they tell me cupping works really, really well. It's very cheap, effective, and it works for quite a bit of chronic pain because you will be using it for a long time because you are in pain very regularly. eBay search, the cupping sets to go from anywhere from $2 to $60. So I've had patients buy the $2 ones. You can start off with the $2 ones. I will tell you right now, they will fall apart after you use it once or twice, but that'll let you know how to get use of it and whether get a feel for it. And then once you get more confident with it, you can buy a set that's like $30 or $40. You can have it just apply it onto the points that are painful, and it pretty much is a reverse massage. It pulls the muscles and lets it relax afterward. How long do you hold the points for? So most of the videos I do, I recommend 15 to 30 seconds. If you find a spot, just hold it 15 to 30 seconds, let go, 15 to 30 seconds, let go, and then try your neck, see if that helps or not. But if you guys have any questions, keep asking. I'll keep answering them as well. So again, I haven't been on this group for a while. I'm trying to make I'm gonna try to do at least one live a week, depending, because my schedule is it's a teething process with clinic right now because it's just I've been bombarded and I can't keep up with the patients, and I'm in the process of hiring a new receptionist. So I'm going, which is good. So it's a good problem to have, but it's I'm trying to juggle the time right now between the kids clinic and this, so it's been really good. I'm glad that this group, if you guys have questions, keep answering, and I'm really glad, more than happy to help you guys out. So if you guys don't have any more questions, I'm just gonna wrap it up. So the OBS right here. So again, if you're watching on YouTube, make sure to subscribe. Check out the Acupressure booklet that I've got out as well, and if you guys are interested as well, again, if you guys have friends that are interested that have chronic pain as well, check out the acupressure courses. Prices are going to go up probably in a week or two, so neck and back pain bundle, or either or. So check it out. All right, guys. If you have any questions, please keep posting. I will keep answering them. All right, no problem. Good night, guys.